Hey everybody, it's Catherine from Nurse Love 101, and I wanted to get in here and talk about a little discussion about some things that a lot of nurses might be thinking about recently. And that's number one, is there a nursing shortage? That's a tough question. Number two, is it worth getting my bachelor's degree? And I'm gonna be honest, this opinion might be a little biased by the fact that I don't have my bachelor's degree, but I still work as a registered nurse and I make sufficient income, and I'm even a charge nurse. So let's get into the whole discussion, okay? And this is what it really boils down to. Is there a nursing shortage? Well, I don't know for most states, but I know here in California, in some ways, there is a nursing shortage for critical nurses or bedside nurses where nurses aren't willing to basically work in certain conditions. That doesn't necessarily mean that there's not enough nurses. It just means that there's not a lot of positions that are offering nurses areas where they aren't centered around just bedside. So for instance, let's say you're trying to get a job. You're probably going to start off in med-surg, ICU, telemetry, or the ER, or somewhere like that. You might start off at a hospital, maybe even a skilled nursing facility, depending on if you are a registered nurse versus if you are a LVN. One of the things that I think is important that a lot of nurses need to understand is that when the pandemic hit, it left a lot of nurses kind of feeling like unappreciated. And a lot of nurses might have left bedside. Also, you have to look at the reason why the nurses left bedside. It could have been multiple reasons: burnout, family, life balance, maybe beliefs, maybe reasons of just realizing that maybe they were extending their family and they didn't want to work so much, or deciding that they just didn't want to put themselves in an area of possibly, getting sick or getting injury or blah, blah, blah. So for whatever reason, a lot of nurses did leave bedside. They did, decide for whatever reasons they want to leave. And then also you have to remember that there was the travelers. And a lot of travelers were getting assignments where they were making anywhere from maybe like $5,000 to $10,000 a month. I even hear travelers were saying they were making like $10,000 every couple of weeks or a week. I don't know. I've never been a traveler nurse. I've always been a nurse that worked for a hospital. So I don't know what kind of contracts they were getting. But it seemed like there was a lot of travelers coming from everywhere, right? And one of the things that we do see is that there are nurses from other states, and what they do is they'll come over to California as like a per diem, or as I guess they would have to come as a per diem or as a traveler, and they'll get work there. So what is happening is that a lot of nurses who, let's say, they're from California or they're from, other states. I do think California, we have seen a mass shift of nurses who expect more from their employer. And a lot of that has to do with the unions. Like I said, I'm a huge union supporter. I think having a union is one of the best things for a nurse. It protects her. It also protects the patients. A lot of times the union is fighting for not just benefits for the nurse and the staff, but a lot of times they're actually creating policies and looking at areas that are helping the patient a lot stronger versus helping an individual. And when we think about that, that has to do with really reducing nurse fatigue, nurse burnout, and making sure that nurses have something as significant as meal, lunch relief, break relief, or that there's somebody who is a per diem who's willing to pick up extra shifts so nurses aren't working like 16 hours, 20 hours. And I think there is, I would say, in every nurse's journey, especially for most nurses I know, that there's like this period of time where the nurse is going to want to work like a lot of overtime, right? Like I know I shared my story where I was working like crazy, and I was burning myself out by working 16-hour shifts when I was a new nurse. And a lot of it had to do with because I was like, yes, I'm finally getting paid. I'm finally making money. I'm just going to work myself like crazy. And that's not necessarily the best thing to do, because then now you have a nurse like me who's already got, like 10 plus, years, almost 12 years, 13 years invested. And I don't necessarily want to work overtime. I barely want to work my 40 hours, So you have a lot of nurses who maybe you're like, I don't need the money. I've learned to budget. I've learned to live within my means, where I don't need to pick up overtime, and I'd rather give it to somebody who might possibly need it, So you have that dynamic. Also, another dynamic that, the hospitals aren't necessarily hiring. So there is a huge nurse shortage, but that doesn't mean that the hospitals are just flooded with job postings. It usually takes a hospital a long time to get the position out. It creates this dynamic where they're trying to hire, people are moving. So I feel like every time there's a new nurse in, there's also a new nurse out. There's maybe a nurse that's retiring. There's a nurse that is leaving. There's a nurse that's shifting to another department. There's a nurse going on vacation, maternity leave, whatever. Or, maybe taking some time off or switching per diem. There's always some type of shift in every department. No department's ever going to be perfect when it comes to staffing. And I think a lot of nurses know that. I don't think there's actually a nurse shortage, meaning we don't have enough nurses. There's tons of nurses everywhere, but some of the nurses just don't want to work in certain departments anymore, and they don't want to put maybe their nursing license on the line. They don't want that liability of possibly working in the ICU, working in maybe pediatrics of a busy hospital that doesn't have significant staff. So there's a lot of things that are going on. Do I think that it's possibly a benefit to still become a nurse? Yeah. I think now that there is a lot more chances for a new grad to get a position versus a nurse who back in 2008, when I was out of nursing school, 2008, 2010, there was this area where they said, we just aren't hiring nurses. A lot of new grads were having a hard time getting a job. Now I hear like a lot of new grads are getting jobs. They're getting jobs in the emergency room. They're getting jobs on med surg quite easier than maybe before. There's always going to be kind of like that difficulty of possibly having a hard time getting a job right away because you don't have any experience. But for a lot of people, I'm hearing that a lot of new grads are getting jobs because of the nursing shortage. And I do see a lot of the hospitals are posting a lot more job fairs, a lot more new grad programs. So I think that there are the need for nurses. Definitely, 100%. We always need nurses. Nursing is a profession where you can move around. You can be an emergency room nurse, then you can go to the clinic. You can do flight nursing. You can work transport. You can work just about anywhere. Case management, advice nurse, virtual nurse. Yeah, there's even jobs as like advice nurse and virtual care. So there's all kinds of nursing positions. And I think with more virtual care, that a lot of nurses who have done their bedside care are now saying, you know what, I want to try something else. I'm going to be an advice nurse. I'm going to be something else. Do I think you need to get your bachelor's degree? Okay, so I'm going to be honest. I think if you want to move up and you want to maybe get in leadership, management, education, quality, something like that, or you want to work for like a magnet hospital, it's beneficial to have your bachelor's degree. Do I think you need your bachelor's degree to be an amazing nurse? No, not necessarily, not at all. In fact, I've seen a lot of nurses who have their bachelor's degree and for whatever reason they decide they don't want to do like bedside, so then they structure themselves somewhere else, and that could be management, and that could be education. Like I said, if you have your bachelor's degree, it's probably easier for you to get out of that emergency room, that ICU, that understaffed med-surg department, and shift to a different position. You will need a bachelor's degree if you want to get into management, if you want to get into a different type of role. Do I plan on going back to get my bachelor's degree? I'll be honest, no. Because I'm probably going to spend, will my hospital reimburse me? Yes, they will. But I don't know if I want that stress. I don't know if I want that stress. I like the position I'm at. I plan on retiring in the position I'm at. I'm going to just be there until I retire. That is my mindset. And to me, I don't necessarily want to do management. I don't necessarily want to do anything else. But where I'm at right now. So I don't see myself shifting to have my bachelor's degree. Should I get my bachelor's degree just to get it? Possibly. I might have to reflect on that just to say I have it. Maybe I want to write some nursing articles. I don't even really like to write. But, right now I'm at a point in my life where I like other things. I like learning about some of my hobbies, reading stuff that has nothing to do with nursing. So for me, not right now. Maybe when I get a little bit closer to retirement, I might go back and get that corporation to reimburse my tuition. But a lot of corporations and a lot of hospitals will actually reimburse you. So if you are only getting into an associate's degree program, that's not a bad thing. Go ahead, take it, get your foot in your door, get that hospital to pay for your bachelor's degree, if that's something you decide to do. But like me, I work as a charge nurse, and I also feel like I have a lot of experience, and I have that area where I'm able to communicate, and I'm able to step into a leader role without necessarily having my bachelor's degree. And I also feel like I have learned a lot of people skills, and just I've seen both sides of it, leadership and having that charge nurse role, and then also being on the other side of working in the emergency room and other departments for a long time. So I don't necessarily think you have to have your bachelor's degree to be a nurse. It is something that's beneficial. But in all honesty, if hospitals and nurses from other states are coming over to California, you might want to get it to make yourself look more potentially as a higher candidate, as a higher qualified candidate, if you have that opportunity. But if you get into a nursing program, get into the nursing program and go ahead and do it. I should do a video on how I survived nursing school, because in all honesty, I'm not a very studious person, but then again, it was tons of years ago, so who knows what they're doing now with nursing school. But that just kind of shows you that having that book smart isn't necessarily going to get you everywhere in nursing, right? Sometimes you have to have that people skill, that bedside manner, and also that area where you see both sides of the table, right? You see what not only does the charge and the leadership want and expect, but you also see the other side from the bedside nurse. And I know like there's a lot of nurses who have their bachelor's degree and maybe do 1 or 2 years bedside, and then they're like, I'm moving up. I don't want to do bedside. And I get it. Bedside's not for everybody. It's grueling. It could be hard. It's hard on the body. It's hard on the mental state, and sometimes it's hard on the soul. There is a lot of burnout with nursing, and developing good coping skills to detach from the profession, I would say, is one of the things that kept me afloat as a emergency room nurse and as a float nurse. But, I hear nurses all the time say, I want to get out of nursing. I want to get out of nursing. I want to do something else. And I think a lot of times it has to do with different reasons, just being understaffed, feeling underappreciated, working 12 hours, no breaks. But then a lot of nurses do like the money that you can make here as a nurse, and they know like they might not make that money anywhere else. And those are the nurses who I feel like are addicted to nursing or addicted to money, right? And that's an addiction too. When you're working 5 days straight, what is that doing to the body? What is that doing to the mind? What is that doing to the spirit and the soul? Like, what is that doing to you as a whole? Where's your life balance at, And I get it, but I've heard so many sad stories about nurses who have literally worked themselves to death. They've literally worked themselves like crazy. So that's something that I have always been like, after the few years that I worked a lot, I kind of said, you know what? I don't want to work myself like that, because I still enjoy nursing and I still enjoy the profession. So it is something that I do need to balance, because sometimes picking up that overtime isn't going to make too much of a difference on your life. And in all honesty, what's the point of picking up so much if you aren't enjoying your life, right? Like what's the point of having all this money if you're always at work? So that is my take on a couple questions that I have kind of been receiving and seeing in the talk a lot of the nursing community. So I want to thank everybody who tapped into this quick little conversation about nursing. I want to ask you guys some questions. If you're a nurse, what stage are you at? Are you a student nurse? Are you 5-year nurse? Are you a new nurse? Are you a fully invested nurse? Have you been there for like 10 plus years? And how do you manage, right? Let me know in the comments. How do you manage life and this area of nursing, burnout, and giving? Caregivers, and that's what we are. We're caregivers. We care for other people, and a lot of times, sometimes we forget to care for ourselves. So that's something that we need to definitely look at. So yes, I don't think there's a real nursing shortage, but there is a demand for nurses on the bedside. No, I don't think you need to have your bachelor's degree to be an exceptionally wonderful nurse. You go ahead, go get that license and become an amazing nurse. And thank you for watching Nurse Love 101. Bye!